Good afternoon, Dr. Libby. My name is Erica Dorr. I am the Associate Director of the North American Thrombosis Forum, and I just wanted to take this opportunity to thank you for taking the time to speak with me today. I also wanted to congratulate you on being the first recipient of this lectureship award. We're very happy to hear you accepted and that you will be speaking at the Thrombosis Summit on September 8th.
It's great to be here. Thanks for the opportunity and honor.
Would you be able to give our audience a background on your experience and the point where you began your relationship with Dr. Sasahara?
Well, I first became aware of Dr. Sasahara as a prominent physician who was interested in venous thromboembolism and pulmonary vascular disease. But I really got close to him when I served for 3 months as the chief medical resident at what was then called the West Roxbury Veterans Administration Hospital, which is our affiliated Veterans Affairs hospital here at the Brigham Women's Hospital. It's now called the Boston VA Medical Center. And I went out there for 3 months and worked very closely with Art. And it's the beginning of a relationship that has borne fruit over many decades.
When working under Dr. Sasahara, what were the most fulfilling aspects, and what do you still carry with you today in your work?
Well, I certainly learned a lot of medicine working with him as chief resident. We did morning report, I did a lot of teaching rounds, but you know, the facts of medicine change from year to year, and the most important things that we learn from our mentors are the way of thinking, the approach to patients, and also how we conduct ourselves as professionals and as people. And I have to say that I got the expected medical education with Dr. Sasahara when I served as his chief medical resident. But what I didn't appreciate and didn't expect was the opportunity to learn from someone who was much more skilled and much more experienced and mature at human relationships, which are a very important part of our job, not only with our patients, which is something we're conscious of from the very get-go in clinical medicine, but also with our peers. And as chief medical resident, I was supposed to be the leader of all of the doctors in training at the program there. And I was a bit rigid at the time, and I had very high expectations. I'd been held to high expectations, and sure enough, people who were working under my leadership were going to be held to those same standards. And there were several incidents that came up during my tenure as chief medical resident where I had an approach that was a bit inflexible and obdurate and perhaps unnecessarily harsh. So there were messages that could be given in different ways. And what I learned from Art during that time was how you can be more effective as a leader and role model if you present things perhaps in a softer way or a less abrasive way than I had been planning. And those were some of my first lessons in leadership. And I have to say that I try to remember those lessons today, and I'm still working on softening those rough edges as I try to lead a large group of very talented people forward with very high standards and expectations.
Do you have any stories or anecdotes that come to mind when talking about your time with Dr. Sasahara and the way that your relationship grew?
Well, you know, I started out as his mentee in a relationship that was one of a chief of medicine to a senior resident. And I was very much in the receptive phase and growth phase of my own professional development at that time. And I have to say, when I would walk into his office, sometimes a little steamy, to tell him about some problem and how I would propose to take care of it, he would very calmly go over to a sink which he had in his office with a spigot, of which he was very proud, that would dispense boiling water. and he would offer me a mug of tea, which he would make with a little ceremony in the office and offer it to me. And by then, the steam had begun to moderate a bit. And then over a cup of tea, we'd talk through the problem. And by the time I left his office, I was calmed down, and I usually had a much more mature approach to the problem that I had brought to him, leaving his office than going in. And I have to say that the way in which you have these difficult conversations, I have a number of them on my agenda today, really makes a difference. And you don't perhaps appreciate when you're younger that if you're a leader, the words that you say and the way you say them can be very, very influential, and you can convey the message in different ways. And I think I really owe to Art a great deal of early mentorship in the skills of leadership, which I try to practice and am still working on today.
That's great. As you obviously know, Dr. Sasahara has been incredibly successful, but what would you say are some of the highlights of his career?
Well, he was really one of the pioneers in studying veins and thromboembolism and pulmonary embolism. He made major contributions through the year. You know, we take for granted today in cardiovascular medicine clinical trials where we test in a drug with an action against some kind of a control or a sugar pill, placebo, and we try to measure some kind of objective outcomes in a way in which the investigators and usually the participants in the trial, the patients or volunteers, don't know. And we take this for granted now. We call it the gold standard of clinical investigation, is the randomized clinical trial. But 40 years ago, when the possibility of using clot busters to treat pulmonary embolism came on the scene, this was not the usual way of answering these questions. People would usually use anecdote or a little case series or a single center experience. And I think it's a testament to Arthur's vision that he put together and carried out one of the very first clinical trials of lytic therapy. And this was in the venous circulation treatment for pulmonary embolism. And this was before the advent of the trials of clot busting or thrombolytic drugs for coronary artery disease, which has gotten a lot more attention and press. And you really have to put yourself in the shoes of someone who was practicing a half century ago to realize that he was a revolutionary, and that it required not only the vision but organizational skill and operational skill and the ability to execute and the ability to get a bunch of people who are rather headstrong, and doctors tend not to be wallflowers and not to be shy and not to underestimate themselves. And to lead a clinical trial requires being able to deal with all of these egos, all of these logistical challenges. And my hat is off to Arthur for having been one of the pioneers in this very important field, which, as I say, now we take for granted and is now required for the registration of a drug in our field. But he had the foresight and the ability to actually pull this off 35, 40 years ago. So he deserves a tremendous amount of credit. Now, of course, he's made the contributions to the diagnosis of venous thromboembolism and pulmonary embolism through the years, but I really think that the signal achievement, which I think few could have pulled off, was really what I think was one of the first rigorous randomized clinical trials in our field. And it's a model for us, and it's inspired many of us today.
What were your first thoughts when you found out that there would be this lectureship for Dr. Sasahara?
Well, I thought they got the wrong guy, because I don't really work that much in venous thromboembolism, and I thought there's so many more deserving people. But, you know, I'm very humbled by it, and as our relationship has evolved over the years, I became Arthur's supervisor, and I have to hand it to Sam Goldhaber because he was the one when Arthur finished his second career, because he went from a career as a chief of cardiology, chief of medicine, with all of the kudos and all of the distinctions that go with that successful academic career. He went on to another career trying to, in the private sector, develop thrombolytic therapy, not just for pulmonary embolism, but for coronary disease and for cerebrovascular disease, to try to treat strokes and heart attacks as well. And then he did a third career coming back to us, and it's Sam who had the vision to say that Arthur was by no means done, and he had a lot to offer and a lot of value. And I have to say the door was wide open when he suggested this. And so Arthur became one of my faculty members. And of course, I continued to learn from him as he contributed his wisdom and experience and leadership to us during the years that he spent as a member of my faculty.
How do you feel that you were the first recipient of this lectureship award?
Well, as I say, I think it's quite humbling, but it is also raises the bar for me. It's an inspiration for me to try and achieve on the level and consistently and with the longevity that Dr. Sasahara has brought to his career. And so by delivering the first Arthur Sasahara lecture, I hope that that's just the threshold of the next phase of my career, using him as one of my role models for someone who is able to give back to the community as well as receive.
Well, thank you again for your time and giving this interview and accepting to be the first recipient of this award. After talking with Dr. Sasahara, he's very honored as well. I'm very proud to have you as this first recipient. So thank you again, and we will see you in September.
All right, thank you for the opportunity.